Hello friends, in Anatomy and Physiology class, this is Hassan David, your Anatomy and Physiology instructor at Madison College in Wisconsin. Tonight, we're going to talk about the muscular system. Muscles constitute a large part of our body. There's about 650 muscles in our body. Muscles help our body to move from place to place. Muscles help to shape our body. Muscles also help our body to generate heat. Muscles also give us identity. We're going to talk about the gross anatomy, or how the muscles look like. We also gonna talk a little bit about the histology or microscopic structure of different types of muscles. We have three types of muscles that we have identified in our body. We have muscles that we find in the heart, and we named it the cardiac muscles. We also have muscles that are attached to the bones, and these are the skeletal muscles. We also have bones that are found in the internal organs. We found them in the arteries and the veins, and these we call smooth muscles. I have models here to share with you of these types of muscles. This is a model showing the skeletal muscles, and as you see here, the muscle fibers are striated muscle fibers. See the striations? There is more than one nucleus. If I turn it this way, you're going to see the nerve endings, which we call the end plate, or the motor unit, the end motor plate. Nerve come and are spread in the muscle fibers to innervate the muscle fibers. Muscles, or skeletal muscle fibers, or the skeletal muscles, are voluntary muscles. They lack the intercalated disc, and this is opposite to the cardiac muscles. They also have striations, and you see they have the muscle fibers. In the other side, looking at the cardiac muscle, this is a model of the cardiac muscles. You see also the nerve, and you see the intercalated disc along with the striations. If I turn it the other way also to expose the interior of the muscle, show you the intercalated discs, 1, 2, 3, and the big nucleus in the middle along with the muscle striations. Also, you want to look and observe the nature of the muscles. They kind of branch and rebranch, and this is a feature you see in the cardiac muscles. Cardiac muscles are found in the heart, as we said. Taking a look at the smooth muscle, you want to see the spindle-shaped fibers. Look at the pointed ends, two ends. It's kind of pointed. Look at the nucleus, big in the middle. And look at the muscles, fibers. They're not striated muscles, and they do not have intercalated disc. I'm going to turn it all the way so you can take a look at it. Muscles, fibers are spindle and also innervated by nerves. This is the nerve endings, but features are spindle shapes and no striations. Smooth muscles, as we said, are found in the viscera, in the arteries and veins, and some of the hollow organs like the intestine or in the arteries. Muscles are classified according to many criteria. Some are classified according to the shape, like the deltoid muscle, looks like a delta or triangular shape, or they are named according to the muscle attached to it, like the Sternocleidomastoid muscle. This muscle is named because it has some attachment to the sternum or the clavicle and the mastoid process. Or muscles are also named according to their location. If they're deep, they're named profunda, or superficial, like superficialis. Muscles are also named according to the action they perform. Muscles that extend the joints or extend limbs are named extensors, while muscles that flex the joints are known or named as flexors. Also, muscles are named based on the function they do, and so forth. we have divided our body muscles into different categories for the purpose of studying it or simplification. We are going to look at muscles of the face, and this we call muscles of the facial expression. We also have the muscles of the chest or the trunk, back and front. We also have abdominal muscles, and then we have muscles of the upper limb and muscles of the lower limbs. I'm going to start off with muscles of the face or muscle of facial expression. These are the muscles that are found in the head, front and back, and on the sides, and they are known as the muscle of facial expression. These muscles are attached to the bones of the skull, or some of them are attached to the skin. The muscles of the face are symmetrical or bilaterally represented. Muscles of the face are also take the form of the contour of the bone that are they lie on top of, like muscles of the cheek or the mandible, and the muscles over the forehead. I'm going to start off with the muscle of the forehead. This is known as the frontalis, and the frontalis muscle is the muscle that wrinkles the face or the forehead in case of surprise or something like that. This is the Orbicularis Oculi, and this is the muscle that is surrounds the eye, and it helps to tighten the eye when we close our eyes. Orbicularis Oculi. This is the upper or the lower lid of the palparis muscle, or inferior palparis muscle, and this is lowers the eyelid. It also helps in closing the eyelid. We also have the Orbicularis Oculi here, and this is the muscle around the mouth or the oral cavity, Orbicularis oris. It encircles the mouth, and a sphincter muscle of the lips with its fibers that runs in many different directions. These muscles also help us to whistle or tighten our mouth. You go down a little here, you're going to find the Zygomaticus muscles, the two parts, minor and major muscle. The Zygomaticus muscle extends diagonally, as you see here. They extend from the corner of the mouth to the cheekbone. And the Zygomaticus, as you see, they are originated in the zygomatic bone, and they attached to the skin muscle at the corner of the mouth. They help raise the lateral corner of the mouth upwards upon smiling. The temporalis muscle, as you see here, this is the muscle that fans. It's a fan-shaped muscles over the temporal bone, as you see that. It's right on top of the temporal bone, and it closes the jaw and elevates the mandible also. The buccinator, as you see, this muscle is right in here. You can see it. Also, this is one of the muscles of mastication. It helps us also. It compresses the cheese in whistling and holds the food between the teeth during chewing. And the buccinator muscle is the principal muscle of the cheek. This is the principal muscle of the cheek. It originates in the maxilla and the mandible, and it is also inserted along with the orbicularis oris muscle, as you see. The sternocleidomastoid is one of the muscles here that has two-headed muscles, and it originates in the sternum and the clavicle, and is inserted in the back here in the mastoid process of the temporal bone. So it originates in the sternum and the clavicle, and it inserts into the skull. It helps also in contraction of both the muscles both of them cause flexion of the neck upward, and they act independently to rotate the head towards the opposite shoulder. So it helps our head to rotate the right and to the left. Sternocleidomastoid. As you see the name Sternocleidomastoid kind of tells you this muscle has some connection with the sternum and the clavicle and the mastoid process. This is a trapezius muscle, as you see here. And this muscle helps our to shrug the shoulder. We also have other muscles in the back. Occipitalis muscle. All right, and we also have the other muscles that are muscle of facial expression. Also have the mentalis muscle right here, and this work in the mandible, and we have the nasal muscles here also, and also we have the other muscles that helps in the facial expression. As we mentioned before, the face is symmetrically represented and symmetrically innervated. So deviation of the facial muscles or deviation of the mouth or drooping of the eyelid might sometimes point to some form of facial paralysis or facial palsy. This can be a sign that is separate or isolated sign of facial palsy or Bell's palsy, or it could be a part of hemiparesis or hemiplegia, or what is known as a stroke, where the mouth is deviated towards the stronger side. So if you see here, take a look at that. The face is symmetrically represented, so we expect the right side of the face and the left side of the face to be imbalanced and of the same power. But when one side is weaker, then the other side will pull it. So you will see pulling or deviation of the mouth of the face towards the stronger side. So the face or the muscles of the face are always pulled towards the stronger side in cases of facial palsy. Muscles of facial expression are tested by asking patients to close their cheeks or show me your teeth or smile, or this form where that will augment or exaggerate the presence or the deficiency or the neurological deficit in the face. This way you'll be able to see more deviation and more symptoms of facial palsy.